Today, I'm going to show you how to perform first aid in different selected situations. These include
dizziness, choking, hyperventilation, nosebleed, dog bite, heat injury, seizure, snake bite, anaphylactic shock and allergy, burn, wound, fracture, shock, drowning, and poison.
So what are you waiting for? Let's go!
Dizziness is a word that is used to describe two different situations, such as lightheadedness and vertigo. What to do? First, let the person sit or lie down. Lightheadedness is really relieved by lying down. Avoid sudden changes in position. Let the person drink fluids if there is no nausea or vomiting. Call for medical assistance if dizziness is not relieved after several minutes. Choking is the blocking of the airway that occurs when a foreign object gets clogged in the respiratory tract. It may be partial or complete. What to do? Calm the patient. Instruct the patient to firstly tap out the foreign object. If coughing is ineffective, assist the patient by delivering several back blows between the shoulder blades with the heel of your hand. Observe for complete airway obstruction. Hyperventilation is also known as overbreathing. Signs and symptoms of hyperventilation is chest pain or discomfort, dizziness, feeling of choking and suffocating, anxiety, fast breathing, muscle spasms in the hands and or feet, weakness and palpitation or rapid pulse. What to do? As a first aider, you must remain calm. Instruct the patient to perform DBE by inhaling through the nose and slowly breathing out through the mouth with pursed lips. If the patient fails to follow the instructions, use a brown paper bag to compensate the high amount of oxygen in the system. Cover the patient's nose and mouth with the brown bag and allow him or her exhale and inhale inside the bag. This will promote circulation to different parts of the body. Symptoms persist after several minutes. Seek medical attention. Possible causes of nosebleeds: infection, trauma, allergic rhinitis, blood thinning medication, blood disease such as hemophilia or anemia. What to do? Let them sit down and leaning forward, not backward, and pinch the soft part of the nose for 10 minutes. Heat injury is an environmental injury when one is overexposed to extreme heat or high temperature. How to treat heat injury? Transfer the victim to a cool or shady area. Loosen any tight clothing. Elevate the victim's legs in a stroke position. Have the victim drink slowly at least 1 liter of water. Monitor the victim until the symptoms lessen or disappear. 6. Ask doctor's assistance if the symptoms persist. What to do when a person is suffering from seizure? Make space around casualty. Remove any dangerous objects. Protect their head by putting pillows beside their head. Take note of the time when the seizure started and how long did it last. After the seizure, open an airway, check breathing, then put them in recovery position. Snake bite. Keep the patient calm. If there is any bleeding, you must control it using a sterile dressing. Get the patient's seat to avoid infection to the heart. Talk to the patient to make him or her comfortable. allergy, and anaphylactic shock. Seek for medical assistance. If they know that they are allergic to certain food, ask them if they have auto-injector and help them with it. Monitor them and keep them comfortable. Poisoning. Seek for medical assistance. Ask them what they swallowed, how much they swallowed, at what time did they swallow. Look for clues. While waiting, reassure and monitor level of response. Burn. Place under cool running water for at least 10 minutes. If it is serious, call medical assistance. Use a plastic bag if you have no kitchen film. This will protect the burn from infection. Wound. Let them apply pressure to the wound. Raise the injury and clean, dry the wound and apply sterile dressing. Fracture. We must immobilize the fracture area. If it is in the arm, put splint or any hard object to support the arm. Tie it with any clean cloth. Put swing and swat to immobilize the arm. Shock. Help the casualty to lie down. Raise their leg, call medical assistance, and then loosen any tight clothing. Keep them warm and calm with a blanket.
Children can drown in a surprisingly small amount of water. So be very careful, extremely vigilant, and always be sure that you know where the children are if they're around water. The other thing is that children often, if they are drowning, it's not like in the movies when they're thrashing around. It can be very quiet and they can just disappear. So again, vigilance is really important. If you were to find a child unconscious in water, really important that you get them out as quickly as possible. Ideally, head downwards, pulling them out like that. And the moment they're on dry land, what you want to do is tilt the head, lift the chin, check to see if they're breathing. If they're not, you want to start with 5 rescue breaths straight away. And hopefully, those rescue breaths will end up stimulating the brain. The carbon dioxide in your breath that you're breathing out can stimulate the respiratory centre in the back of their brain and cause them to start breathing, which is great. So 5 breaths. If that doesn't work, then 30 compressions to 2 breaths, and you would keep going. You're not going to try and empty them or anything. The majority of the time, there isn't water in the lungs that we hear about. It's just the fact that it's like a suffocation that's happened when they've drowned. So keep doing the CPR, get help on the way. If somebody can bring a defibrillator, that would be fantastic. You need an ambulance fast, and you keep resuscitating. And hopefully they will come back. The chances of coming back from drowning, if you're pretty quick getting them out, are pretty good. Make sure you keep them warm because they'll be cold having come out of water. And if you have had to resuscitate someone, or if someone has been unconscious in water, really important you look out for secondary drowning, and that they are always checked out in a hospital so that they can ensure that there aren't any signs of secondary drowning. Secondary drowning occurs when there's inflammation in the lungs as a result of what's happened in the water, and that causes the lungs to start secreting fluid, which causes this secondary drowning, and that can be fatal. So really important you get them out quickly, you start CPR quickly if that's necessary. If they come round fast when you've done CPR, they'll need to be in the recovery position, they'll probably be sick, they'll probably will be draining some water, but they can cough it all up themselves, and then you get them seen in a hospital as quickly as possible.